for the Thursday roundtable. I am filling in today for Rollis Fontenot. He is actually taking a much needed vacation. I think it's the first vacation he's taken in probably 16, 18 months at this point. So welcome to everyone. Thank you so much for joining us on LinkedIn Live. As you're logging in, please go ahead and drop in the comments where you're logging in from. I'd like to see where we're getting guests from today. Also hit the like button, the share button if you want to. But I am very excited to have some wonderful guests today. And I will let them go ahead and introduce themselves. Dr. Caplan, would you like to get us started?
Yes, of course. I'm Ron Caplan. I'm a clinical associate professor emeritus, obstetrics and gynecology, Cornell University Medical College. And I'm also a medical author and publisher.
Thank you so much. Welcome, Dr. Caplan. Dr. Prosser, would you like to go next?
Sure. I'm Jay Prosser. I'm the Assistant Chief Nursing Officer at a large hospital in Birmingham, Alabama. I've been a registered nurse for 17 years. Started out as a ADM prepared critical care nurse and advanced and got my bachelor's, master's, and doctorate in nursing practice. And for the last 9 years, I've been in nursing leadership, and 3 of those in executive nursing leadership.
Thank you so much. We're so excited to have you here today. And finally, we'll have Dr. Botelho.
Yeah, thank you. I'm Rick Botelho. I was a professor of family medicine at the University of Rochester, moved down to Charlotte, North Carolina, and I'm working in an integrative internal medicine practice at the moment. And I'm finding it fascinating to work in that environment. I'm Rick speaking.
All right. And how long have you been practicing medicine?
40 some years.
40 some. And I think, Dr. Caplan, you've been practicing for...
Yeah, I have indeed. I've been practicing more than 50 years.
So we have an incredible panel today of absolute experts in their field. And we're going to talk about, some really difficult issues. So if you guys have questions in the audience, please feel free to ask them. Just type them into the comment box, and I will make sure that our guests today see them. We're going to talk about COVID burnout in the healthcare setting and the vaccine hesitancy and resistance from healthcare staff, and why that is leading to staff leaving the healthcare setting, and what our organizations and leaders can do to help retain that staff. So let's go ahead and start with Dr. Botelho. You're the one that came up with this great topic, and you have a lot of stuff that you wanted to talk about in it. And I wanted just to ask you, what made this this topic so important for you to want to talk about? What are you seeing currently where you're at?
Well, let me just say a very brief story. At the very beginning of the COVID crisis, there was a monumental drop in office visits. And I was in a situation where they didn't need me. So I was given 4 hours notice that my services weren't needed. So that happened right at the very beginning. And it gave me some time to step back from the sort of, the urgency of the situation and take a sort of more of a meta perspective of looking what's going on. And I think one of the things about the COVID burnout issue is that it actually highlighted a pre-existing burnout issue that was already there, particularly in health in primary care, where the burnout rate amongst physicians is running very high. So, and the reason why I brought up the issue of COVID hesitancy and resistance is that I'm actually starting to see nurses who are my patients who are coming in, and for a variety of different reasons, which we can go into later, they are either hesitant or very resistant against having it. And locally, 2 hospital systems are introducing mandatory vaccinations, and actually that's contributing to the burnout. And I think they could have done a better job of anticipating that predictable backlash. And there was even a local protest about it. I'm Rick, and I'm done speaking.
Oh, appreciate that background. And I'll ask each of my guests to kind of give me the background of their current locations, kind of what's happening where they practice and what they're seeing in their current locations. Dr. Botelho is in North Carolina, and Dr. Prosser, you are in Alabama. Do you want to share with us what's happening in your area and what you're seeing with your clinicians right now.
Sure. So certainly right now we're definitely in another surge of COVID. As you know, Alabama's been in a battle to be last in vaccination rate. So no surprise that we're battling that right now. The current prediction models are forecasting that by September 1st, we'll have almost 2.5 times more people hospitalized from COVID than we did at our high point in December and January. The issues that we encountered really with the first surge of COVID was that it was something new. There was no vaccine. We were very unsure about treatment. And then there was a high mortality rate. And so what I saw was a lot of nurse burnout, a lot of nurse stressors. And so what we really had to do was, open up some counseling for nurses, grief counseling, coping counseling to really kind of help them through the pandemic. This wave is different. And Birmingham is a large medical community with a lot of large hospitals, but it's a very well connected medical community. So our struggle is not unique in our hospital, but rather it's I would say nationwide, but certainly within Alabama and the Birmingham area. The two issues that I'm facing now is resiliency for sure, but also redundancy. I have no redundancy built into staffing models because there's such a strain on staffing now. This was not the case when COVID first hit. We had the staff then. And now we have no redundancy in the staff. And then I'm really worried about the nurses. Are they up for another battle with this? And what is this battle going to look like? If we follow the current prediction models and those actually do turn out to be correct, we're going to be in a situation where we don't have redundancy in Alabama with staffing anywhere in the state, especially in the South where it's the worst now, to be able to handle this. So it's quite a scary situation for us right now.
Oh, it sounds like it, but thank you so much for sharing your perspective and what you're experiencing right now. And Dr. Caplan, do you want to share what you're seeing and you're in New York, is that right?
Yes, we were the first epicenter in the United States of this outbreak for a lot of reasons, which I could get into. But first, I would very much like to compliment my colleagues on this panel, and in fact, healthcare workers everywhere, both in the United States and around the world, for the incredible sacrifices up to and including death that they made in order to make sure that we all survived. I, of course, was not allowed to get into direct patient contact because of my advanced age. And as much as you feel guilty about that and you really want to be there, I was just too much at risk. So I was isolated from that, and I was quarantined being in the New York area. There were a lot of really, really bad political decisions made in New York, as I'm sure everybody knows by now. We didn't say it at the time too much because we were too busy trying to get things done. I'm more involved now in the educational aspect. As a matter of fact, I had a book coming out called Long Leg Strategy just when the epidemic hit, and I stopped publication just so that we could get data on the pandemic into the book. It's an audio book now, but the gist of it was I was amazed at how much information I had in that book prior, without even knowing we were getting into this pandemic, about the kinds of situations we had that would exacerbate this kind of thing. One of the big ones, of course, and what happened in New York, of course, was the nursing home situation, where the political leaders were sending people into the nursing homes with COVID from the hospitals. It was really something, and people died in droves. We've had in the United States, I think to this point, a staggering number, 630,000 deaths from COVID-19. A good percentage of those early on were in New York State. Now, really anybody for the type of structure of New York. It's this massive city with people living in very close proximity and working in very close proximity. And as has just been stated here, we didn't have a vaccine. We didn't have anything. We didn't have treatment. We didn't really know what to do with this. And sending people into the hospitals to be cared for by healthcare workers who were doing their level best to just keep people on support till they could recover themselves, and working incredible shifts for incredible small amounts of money. It certainly put a burden on the healthcare system, even in a city like New York, where we have so many major medical schools. So
Absolutely.
this is where we were, and of course we have to compliment the federal government at the time, which put on an all-court press to get vaccines done, and the much maligned pharmaceutical industry, which got together and did whatever they did. It was like a wartime mobilization.
Absolutely.
I am old enough to remember World War II and what happened there, and when the entire country mobilized to do something, and how incredible it was. And we did it again. And I think that goes down to every person who did anything to help getting the materials out there and everything that the healthcare workers needed to get this under control. And of course, the big thing was, and still is today, the vaccines.
Mm-hmm.
And the vaccines, luckily, just luckily, we're on to Delta. If you know your Greek alphabet, alpha, beta, gamma, delta. So hopefully we won't get to epsilon, but we probably will. Delta came out of India originally, was first identified in India. The original COVID vaccine, of course, COVID disease, of course, came out of China, as I'm sure everybody knows. And this Delta variant has really been what's driving the conversation now. It's very infectious. People are getting sick. People are dying. And yes, there's all this sort of excuse thing going on where people are saying, well, even if you've had the vaccine, you can get sick. Very true, but chances are you're going to get mildly sick, and chances are you're not going to need hospitalization and take up all the time and the effort of these healthcare workers who've been going through this for more than a year now with no respite.
Right.
So the big message still is get vaccinated.
Yes, I would agree. And I know that that's what we're going to talk about today, and about the hesitancy upon the part of some in the healthcare profession. And Dr. Botelho wanted to talk, specifically about some mandates that are coming from organizations here in Houston. One of our largest organizations, they did do a mandate for vaccinations, and it held up in court. And now they're seeing some other hospitals across the United States that are doing the same thing. And what Dr. Botelho wanted to talk about was how they could better handle the messaging, the understanding around it. Would that be accurate, Dr. Botelho?
Yeah, I think, you have to take, each state is different. The political climate's different. You're looking at what's happening in Florida, where they're trying to do mandates, but the corporations there are getting around the objections to the legal mandate by saying that if you go to work, you're going to have to be tested on a regular basis, et cetera. So they have a choice: get vaccinated, or you're going to have to be tested on a regular basis and wear masks, et cetera. So each state is different. It'll be interesting to see what happens in Charlotte, North Carolina. But just knowing, I just came from a clubhouse meeting where I went into a libertarian bubble there, and they were creating Rand Paul about we're going to resist, et cetera, et cetera. And if we don't really understand the mindset of people who we just simply don't disagree with, simply don't agree with, and we just push ourselves onto them, then you're going to get an inevitable backlash. And
right.
And so the question is, I can't even say I have the answer to it. I'm just simply saying we have to draw attention to the fact that it's going to come, and we have to develop a response, and it requires a team effort. I think healthcare systems, if they haven't already done it, and I haven't witnessed this yet, and there probably is somewhere, is to begin to having Zoom town forum meetings, bringing perspective in. And there's different ways in which those sort of forums can be structured. And I'll just give you one way of thinking about it. And this is a way of getting at how people perceive the risks and benefits. So if you look at the benefits and concerns of getting vaccinated, for example, versus the concerns and benefits of not, it's a 2x2 table. You fill in all the sort of proponents for the vaccines, the benefits, and all the concerns, and vice versa for against it. And when you start listing all the details there, you can start drawing attention to the fact that as long as you perceive the benefits of the vaccine in favor of the risk, you're going to take it. On the other hand, if you maximize the long-term concerns that people are really fearful about, even though we have no evidence that it is going to have long-term consequences, but we don't know yet because it hasn't been around for long. As long as people cannot tolerate that uncertainty, that fear, and we can't waylay their uncertainty and fear, they're going to resist it. So I think we have to be very empathic. And I think one of the problems is that people are coming down hard on this, and all it's going to do is make people much more resistant. And I'll just finish with this brief story, because I had one patient who came in. Her pastor was against the vaccine. And so that was one. But he said, if you want to get it, it's fine. I'm not going to stop you. But she had very strong religious objections to it that had to do some ideas that were a little bit based on disinformation or misinformation, depending on who's curating it. And she's latching onto that. So her religious beliefs are saying no. And if we cannot understand the resistance to it, or their hesitancy or their ambivalence, we can't begin to help them see the risk and benefits and the perceptions of things in a way that might allow them to make their own choice. So when I talk to patients, say, I'm not here to change your mind. I'm just here to explore how you perceive the risks and benefits of having the vaccine versus not having it. We can lay it out, have a discussion about it, go home and think about it, and let's talk about it again. Because nobody's going to come in and a 15-minute encounter
change their mind. Yeah,
I'm going to get the vaccine today. I'm going to get it today. It's still going to happen.
Right. It's that consistent messaging, and I think that different states, like you said, have different philosophies. There's a lot of information out there. There's a lot of disinformation, and any friends or family that I've talked to, I've always encouraged them to talk to their medical provider. Get the scientific data. And I find it a little bit hilarious that people, feel like maybe their Google skills are up to snuff against, maybe somebody like you or Dr. Caplan, who have spent decades in evidence-based medicine, and learn from the experts. But I also agree with you, and I really appreciate the way that you approach this, Dr. Botelho, is understanding where that hesitancy and resistance comes from and meeting them where they are. Understanding what it is that they're hearing, what it is that they're reading, where they're getting that information, and trying to really provide adequate evidence-based information and let them make the decision. So I'm sure your patients appreciate it as well.
Just to add one thing, in a wider context, very briefly, in a wider context, there is a lot of distrust out there towards physicians and towards the CDC.
Okay.
And I just came from a clubhouse meeting where it was in oodles. I was in a libertarian bubble, and the distrust, paranoia about, Fauci, et cetera. And if you don't respect that, even if you disagree,
right,
you're going to run into difficulties. So anyway.
Absolutely. And I think that, people hold very, very near and dear beliefs, whether it's religion or politics. And that's what we've gotten into, is a situation where there is that type of misinformation, but by just discounting those people as not understanding, or they don't know, really, like you said, understanding and being willing to talk it through and meet with them. I think that's the way that you really have to do it. And you had this experience where organizations are having a really big backlash to their mandates and protests because they're not providing that upfront information, or like those town hall or really clear and concise information and communication. So before we move on, I wanted to say hello to all the people that are on. We have a bunch of messages. Kim Ali, she's a nurse. Shona Elliott. I see Neville is logged on. We have David Holland. Thank you guys so much. Joanne is here with us today. And she also said that she's in the Philippines right now. And she said that most places are very much locked down there because of the Delta variant. And we're seeing, I saw that there's a bunch of new travel warnings about going outside of the United States again. We're working back towards the masking and the social distancing and no traveling. So it's kind of a dire situation. And as healthcare providers, how are your staff? Like, I wanted Dr. Prosser to kind of talk about this, because you're working day in and day out on, in the hospital. How are your staff reacting to opening back up the COVID floor, about thinking about, oh, we're going to have to do this again? What's the mental space like for those people right now?
So you're exactly right. We opened up the COVID floor. We shut it down, because we got very low numbers. We opened it back up. In a 4 days time, we saw a 54% increase in the number of admissions, and that number has remained consistent. It's 58% higher today than it was 3 days ago. It was a depressing moment for me, to be quite honest, because I felt like in myself as a leader, and I'm on the front lines. I oversee all the COVID operations here. However, I'm not taking care of those patients directly. Mm-hmm. And I felt discouraged. And there was a CNO within our network that made a great observation, and that was this. She says, I'm looking into the eyes of my nurses and I'm seeing dead eyes a lot. Mm-hmm. And it's because these nurses are not just working 3 shifts, they're working 4 shifts, 5 shifts a week. Right. And that's just the staff, because the staffing model is so weak right now. And they've been through a very taxing, a very challenging time. And so I've been trying to, as I'm out on the floors talking to these nurses, I think, it's just about communication, about listening to where they're at and saying, we're going to get through this. I do believe in nurses. As a nurse myself, I'm a big nurse advocate, that nurses are resilient. It's going to be challenging. I think one of the strategies that we're going to implement here is just to make sure we can give them all the support from an ancillary standpoint that we can to be successful. Okay. And that's going to be anything from just even supplies. You got everything you need to do your job. That's one of the functions of leadership, is we have to give people the tools, environments, empowerment, all those things to be able to be a success. I think that's going to be critically important. I think as a leader, my visibility, my empathy, my strength is going to be important. And I was having this kind of conversation in my mind the other day with myself. While this is very challenging and very disappointing that we're headed right back to where we started from, or really in a worse situation here in Alabama anyway, that it's going to be important for me to make sure I'm right too, that I am portraying confidence and I'm portraying a plan, that we're utilizing all of our resources appropriately. And I have to make sure that I'm okay so that my staff will be okay. But I don't think that you would talk to a leader, a CNO, ACNO, or any type of nurse leader right now that wouldn't say there's a part of them that's actually worried about how much more we can take, about how much more we can do. I'm a very positive person. I have all the confidence. I think some of the best nurses in the world are here in my hospital. Now, hopefully everybody else would say that too. But I am concerned about them. I know that they're tired, but our hope is that, this is not always going to be like this. It's going to get better. And while we're in the fight, we're going to be there for you. And, that's what I would hope from the community as well. I know it was referenced earlier in the conversation that there have been a lot of political components to this pandemic, fortunate, unfortunate, both from both sides of it. And this really needs to be really a conversation about these individuals that are putting their lives, their families on the line, and are here to treat patients, and they take care of patients very well every day. They care about the patients, and they are giving everything they have to make sure these people get better. And I think that needs to be our message. And I'm very confident. I'm worried, but we're going to be there. We're going to be encouraging. We're going to be doing everything that we can possibly from our physically, mentally, spiritually, whatever they need to make sure that they have the tools to be successful in what they're doing right now.
Well, I feel like your nurses definitely have a wonderful leader in you. And I'm sure it's difficult. And like you said, I'm sure that they're not looking forward to this, but I'm sure it's wonderful to have a leader like you on their department.
I hope they would say that for sure.
Right.
There is, I'll be honest with you, there, when the pandemic first started, I think one of the things, big disconnect between administration, administration's bad, right? Between administration and the bedside nurse. And that the initial days of the pandemic really demonstrated that we had not done a good job as nurse leaders in being visible, available, or communicating appropriately. And a lot of this, as was referenced about vaccine hesitancy, some of it's communication. It's just about sitting down and listening. I have, right, in our environment, I have nurse leaders that are not vaccinated. And so my conversation has been, tell me why, and tell me what would happen. What would you do personally if we mandated a vaccine at this hospital? What's your decision? Are you going to give up your leadership career at a hospital,
right,
because of your stance against vaccines? And so we're trying to have those conversations and, really just try to listen to see where people are at so that we can, better adapt our approach when we get there. And we'll get there for sure. I think all healthcare systems at some point are going to get there. We have several large hospital systems represented in Birmingham, Alabama. And the very first one is going to mandated vaccines very shortly.
Okay.
And so I called the CNO and I said, hey, let me know how it turns out. We'll watch from a distance and just see. It's going to be interesting. I mean, it's no secret. I alluded to this earlier. We know where Alabama stands in the vaccine numbers. We know the political climate in Alabama. So, I got it. I've lived in Alabama all my life. I understand. It's a challenge, but, it's a challenge we're going to have to address, we're going to have to face, and we're going to have to be very good communicators, but also very good listeners so that we can appropriately address the misinformation, the concerns, or whatever it is, and decide what approach works best.
I would agree. And I would assume that the other doctors here today agree as well. One of the questions I wanted to ask, both Dr. Botelho and Dr. Caplan is what have you seen organizations or healthcare departments do in currently trying to retain healthcare staff? Are they doing things correctly? Is there more that they can do to support and retain and keep those healthcare professionals engaged in their jobs? And you can go ahead and start, Dr. Caplan, if you have anything on that.
Sure. Just yesterday, Genesis Healthcare announced for its 70,000 employees, and they're one of the biggest operators of nursing homes in this country, that you get vaccinated, period. It's a mandate. Now, everything that's been said before on this panel has been exactly right on. We have an ongoing project called The Care of the Older Person. It's resulted in a textbook, which is now in its 4th edition. And the very final chapter of that textbook speaks to spirituality and how you have to encounter people and treat them in accordance with their beliefs. Because if you don't, you're wasting your time. Besides that, of course, healthcare workers, all of us, if we're not compassionate, then we're nothing. So this is so important, but it's gotten to the point now where there is enough evidence out there and there is enough experience out there to know that the bottom line of this entire thing is vaccination. And there are more and more major companies, at least in my area, in the New York area, that are announcing not just healthcare, real estate companies, major ones.
Mm-hmm.
It's usually started by the biggest company, so that the others can follow along, and they're mandating that their employees have to be vaccinated or not come to work. Now, Amazon has approached it a slightly different way. They've announced that nobody has to come to work till 2022. They've pushed back that deadline, and people are working from home and doing whatever they need to do. And thankfully now we have the internet, and we have everything we need in that regard to ameliorate some of this, and so that people can do their work and be effective from home, depressing as that can be sometimes. And people need interaction. We're social human beings. And if we don't get that, that's bad.
Right.
Also, the element of risk and reward. Okay. More and more people are starting to realize, okay, if I get vaccinated, then I could go to my job. In New York, you could go to the theater, you could go to a restaurant. And if you don't, then you, okay. And then there's the familiarity thing, which has always sort of given me an inward chuckle. For instance, you know how your car works, right? I know how my car works, right? No, we don't.
I have no idea.
The darn thing, and you turn on a key, and maybe you steer, and the computers in the car do just about everything nowadays. So you really are flying by wire, unless you're alcoholic. And the thing we know about our automobiles is we're familiar with them. We don't know really how they work, and that's a pretty basic machine. This Zoom thing we're on right now, this computer, I would defy anybody to tell me how this thing works. But I know it works, right? We're talking to each other. So the thing with vaccine is very interesting because it's been around forever at this point, for way over 100 years.
Right.
And it's mandated in, I think, most places in the United States that if you want your kids to go to school, they need vaccination. Okay, so most people, unless there are some small groups that run their own schools, etc., but the vast majority of people get their kids, their little vulnerable kids, vaccinated with, quite frankly, much less sophisticated vaccines that are here for COVID. My big criticism of vaccines used to be that they were trying to get rid of the side effects so much that there was a huge lag time to treating any disease. Like the regular flu vaccine is maybe in its best day 50% effective. And old people die of the regular flu all the time. Okay, so 50-50, when an older person gets a flu shot, chances are it's not going to work. But this thing for COVID, the new vaccines, the new mRNA vaccines work, and they work at a very high level of efficiency. So with truly, from what we've seen, at least over the last year or so, very minimal side effects. Yes, there are a very, very small percentage of people who get horrible side effects and can even die. But that is extremely, extremely rare compared to the disease epidemic that we're faced with. The other aspect of risk and reward is, okay, I got vaccinated and now they're making me wear a mask anyway. Okay, now those of us who are surgeons and nurses know that the regular mask you stick on your face, even if it's brand new and you're in a surgical environment, is not 100%. In other words, it has a limited life expectancy and air is coming in from all different places around the mask. It's not really fitted. So as professionals will tell you, there's something called an N95 mask that nurses, doctors in a high-risk environment will be wearing this mask, and it's N95. Well, what does N95 mean? 95 means that even that fitted mask this expensive piece of apparatus to protect the doctor and the nurse and to stop transmission of a disease is 95% effective. Even that has a 5% failure rate. And everybody's walking around with these masks. I got on a plane a few months ago. I'm totally vaccinated like forever at this point. And I get on a plane and I'm wearing one of these masks, you know, you pull up like a ski thing and you put it over your face. And I'm in the airport, I'm perfectly fine, right? I'm wearing this thing, like you're pretending I'm on a ski trip, which I don't ski anymore. And I get just at the moment I'm entering the plane, the person who's checking my ticket says, you can get on the plane with that, you need a regular mask. So, okay, I'm just a surgeon. I know there's really no difference, but okay. And I happen to have one in my pocket. Okay, so she says, no, you can't change it here. You got to go to the end of the line.
Oh,
so
no.
This is the kind of thing that's going on in the society. That's just a small piece of what people are putting up with. So people are saying, if you're against the vaccine anyway, and you're afraid of what they're going to put in your body anyhow, which I think we've adequately proved that you're going to be fine. I mean, I took the shot twice. I didn't even know they were giving me the shot. You know, you're done. Bye. Takes a second. But the if you're hesitant anyway, and now they're telling you, okay, now to go into a restaurant, you got to put on a mask, and you have this dirty thing that you've kept in your back pocket for the last year, and you stick it on your face full of germs, right? And you can't breathe, and God knows what you're breathing in through this mask that's been around forever. And what are we doing here? I mean, at least know what you're doing. Is there a place for masks? Of course there is, but define it, keep it sensible. And if you do that, maybe people will know, okay, I'm vaccinated. Maybe in most situations, I don't need a mask anymore.
Right. Yeah, I think that, you know, I've seen a lot, just even today, I think Maryland has said that their state facilities, their hospitals, healthcare facilities, and jails, they're going to require the vaccine, or you'll have to wear a mask and be tested. Oregon is doing the same thing. I think that a lot of organizations are doing the same thing. Like, there's a choice, and the choice is you do this one thing, or you're going to continue to get tested and wear masks. And so there is definitely a choice for people. You know, I hope that we continue to put out great information, and that, you know, people like yourselves, experts in the healthcare industry, continue to try to debunk some of the false information that's going around, and just really listen and talk to the people that have those hesitancies. I wanted to ask you guys some different questions kind of about life right now, to have the audience get to know you a little bit. I know that this has been a really heavy topic, and it is very important. But I have a couple of fun questions for you guys, if you don't mind. Are any of you currently watching the Olympics?
Well, I am.
A little bit?
No, not at all.
What's your favorite Olympic sport?
Well, my favorite Olympic sport is now gymnastics.
Oh, okay. I love gymnastics as well. I only watch it every 4 years, but I love it when I do. What about you, Dr. Prosser?
No, I don't watch it. I haven't been watching the Olympics at all, unfortunately.
Oh, do you have any favorite Olympic sport?
You know, gymnastics is nice. But you know, I don't know. I just haven't been engaged with it.
Yeah, it's been tough. We watched badminton the other day. That was interesting. Canoe racing, that was very interesting. We caught that the other night. It's a very strange situation right now. There's nobody, you know, obviously in the audience. There's a lot of precautions going on. But every couple of years, it's always fun to watch some of those. Dr. Botelho, do you have any favorites that you like to watch?
I've only watched a couple of events in the evenings, the highlights.
Yep.
And personally, I just love it all, because it's just people who put their life and soul into something for, you know, at least 4 years or longer.
Yeah.
And they're trying to excel at the top of the game. I just love the spirit of the Olympics.
Yes. I love the underdog stories. Just earlier this week, two competitors agreed to share a gold medal because they had been competing for like over 2 hours in this. It was the high jump.
Yep.
Yeah. And they were just exhausted, and they're like, you know what? We deserve it. Let's both share it. And I love those kind of stories too. It's a strange situation right now, but I'm glad that we're able to watch those. So my other fun question for you guys, or interesting, is if you weren't in the healthcare profession, if you weren't medical doctors or a nurse practitioner right now, what other type of career or job would you like to do? Dr. Caplan, have you ever considered another career?
Not since I was 5 years old.
Well, what was it when you were 5?
I don't know. That's when I started telling people I wanted to be a doctor. But the thing is that those of us who gone through an educational process and who have inquiring minds and like to think about stuff realize that there are many, many possibilities along the way and many things that you can do. For instance, even in medicine, there have been many crossroads in my particular life, and I know in everybody else's, where you could say, I'm going to do A instead of B, and I wish I could do both. Or I want to be in place A instead of B. For instance, I'm licensed to practice still today in the state of Texas, and I came within a hair's breadth of being a Texan. And then I decided I didn't want to be the shortest guy in Texas. So, except for the president who came in Texas, he was pretty short too. But the thing is, you have to make these decisions along the way. And all of us have career paths and career choices. And I think it's wonderful to be in the kind of a free society where you have those kinds of choices.
Absolutely. Dr. Botelho, what would you be if you weren't a medical doctor right now?
I like to put a little context into this because I'm still clinically active in integrated medicine, so I still enjoy clinical practice. So a couple of years ago, I actually decided to become board certified in lifestyle medicine, and I took the boards and passed it. I just wanted to see if I was still able to pass an exam, so I did it. But actually, the thing that happened to me with the COVID crisis, I mentioned this earlier, it gave me some time to think about things. And so I feel like I'm in the beginning of my third act, which I think, Ron, you could probably resonate with. And so I'm just the beginning. And so I'm calling myself the Equity Muse. And the Equity Muse asks big, hairy, audacious questions about how to open and align mindsets to co-design an equitable, regenerative, and sustainable future. And so I'm really looking at thought leadership and taking the meta view, and that's what I'd like to sort of move into. So
that's impressive. And I know that you host a Clubhouse discussion.
Yeah.
Okay.
I've been very active on Clubhouse. I'm learning. I feel like I've got my training wheels on. But I formed a group called Unite Equity Muses, and I held a group this morning for an hour, and it was a small group. But the conversation, I had a couple of people in there who were absolute gems, had a great conversation. So, Ron, hopefully I might inspire you, and I'll even help you learn how to use Clubhouse if you're not already using it. If you can have if you find the right crowd, there's a lot of things out there I have no interest in, but if you find the right group, you can have some very interesting conversations while you're taking a morning walk, which I did this morning. So
that's wonderful. Yeah, I've used Clubhouse in the past. I haven't used it much recently, but I've been in some very interesting conversations there. So, and Dr. Prosser, what about you? If you were not in the healthcare practice, what would you be doing right now?
Well, I love being a nurse. I love healthcare. I love education as well. So I could certainly see myself in some type of professor role. I don't know that that's far enough removed from what nurses do, because nurses have to be teachers as well.
Right.
But I guess in the bigger picture too, I guess if I was just going to go out on a limb, in my spare time, I'm a football official. I know that's a surprise that I have a connection to football living in Alabama. So
not a surprise at all.
I would guess that if the NFL called me and said, "Hey, we want you to be a football official," I might be like, "See ya, bye." I don't know. So
that would be impressive. Yeah.
Not that will ever happen, but I guess I could do that. But for certain, I love to teach, and I love not only to teach nurses, but to talk about leadership. And that's really a passion of mine. But again, that's so connected to nursing that I'm not sure that's so far removed as another career or not.
So that I thank you for sharing that. And in this same theme, can you tell the audience and you guys out there in the audience, please go ahead and answer that question too. If you weren't doing your current job, what would you love to be working at? What would you love to be doing? But what I wanted to ask next is, what was your very first job? Dr. Caplan, what was your very first job?
I basically tell people, sort of tongue in cheek, that I've never held a job. I've had titles here and there, and I've been associated with institutions here and there, but I've always run my own life, or at least I think I run my own life, and had my own practice and built my own environment. And did I ever really held a job?
So even as a teenager, you didn't work at a restaurant or?
Basically, I helped my father shovel coal in a furnace. That goes back a few years.
Just a couple years, yeah.
Back a few years.
Dr. Botelho, what was your very first job?
Well, it's difficult to know exactly which one was the first, but I'll highlight one, which was working in a frozen food factory as the sweeper of peas. So the women were picking up the bad peas, and my job was to sweep them into the gullies below. Anyway, that was and
that is in.
Did enough money in 2 months to be able to travel around Europe for 6 weeks afterwards. So that's what I did.
Wow, that must have been a really good job. A sweeper of peas. That is an absolute first for me. I've never heard that one. Sweeper of peas. And what about you, Jay? What was your very first job?
Well, this is an American classic because I was a McDonald's employee during high school, and it was fantastic. A great job. Learned a lot about life. Learned what I was good at and what I was not good at. So it was a great experience.
That is an absolute American classic. Mine were the very first summer I started working. I had 2 jobs. I was a dishwasher and a babysitter. So I would babysit during the day, like a couple days a week. And then 2 or 3 nights a week, one of my other sisters had a job at a restaurant and they needed a dishwasher. And I became a dishwasher and a babysitter. And I loved having my own money. I thought it was the greatest thing that could ever happen. So I'm glad that we all shared that. So before we wrap up today, when we got on, I had said that just 2 weeks ago, the U.S. Department of Health and Human Services announced that they're going to provide about $103 million to address burnout, the burnout crisis among American healthcare workers. And I think it's coming through 3 different development programs, and there's going to be some grants. At first glance, $100 million doesn't seem like a whole lot to address the massive burnout across the United States. But if each one of you had a piece of that money, what would you do first to address the burnout in your practice or in your department or with what you're doing right now? What would you do to address that? Do you want to start, Dr. Caplan?
Well, I think you basically have to give the hands-on people the equipment that they need to perform the tasks they have to do. And the much bigger question is, how do you ameliorate the situation so they're not in that situation? But that's going to take a little longer.
Yeah. So you would definitely make sure that the people on the front lines have all of the equipment that they need. I think that that's a great idea to relieve some stress.
Anything they need should be immediately at hand.
I would agree. Thank you. Jay, what would you do with a nice chunk of that money?
I think there's two approaches. I think that we have to invest in the mental health of healthcare professionals. That is something that we don't do a great job with mental health anyway, but I think we have to address the mental health needs of healthcare workers. But then secondly, we have to make some investment in recruiting and education of people that go in healthcare, whether it be nurses or supportive personnel. So we have to invest in education because we're still going to have healthcare needs. We're going to have nursing shortages. So I think it's a two-pronged approach. I think we address immediately some mental health, emotional needs, but then secondly, I think we have to make an investment in education in the future.
I wholeheartedly agree with that. Thank you for that point of view. And Dr. Botelho, what would you do with a piece of that $100 million?
Well, I'd like to dovetail my comments on both Ron and Jay. As far as the protective equipment is concerned, I'll just bring up something that's come from my own personal experience, which is in an outpatient facility where they're trying to keep people out who are sick coming in. We were just wearing surgical masks. And of course, no system is 100%. And a couple of weeks ago, somebody came in who got through the net, and I spent, 20 minutes with a patient who was COVID positive. I was just wearing a regular surgical mask, which is not very effective. And so I had to go get tested and whatever. The same thing happened just last Friday. A woman came in, elderly woman. All she had was the snuffles. She'd been vaccinated. I said, you got the snuffles. We got to check. And I'd spent 20 minutes with her before, I realized she had the snuffles because that wasn't the reason for her coming in. Lo and behold, she's positive. So interesting enough, I actually had to go, when I first went to human resources and they gave me the N95 mask, they just sort of said, oh, this fits, put it on. Well, I had to get properly fitted.
Right.
And it took about half an hour to find, it took me 4 masks before I found one that was a good seal. So my question is, are healthcare systems really using the N95 masks, even in low-risk environments? And not only that, with the vaccination being what it is, people can be carriers and you don't know. So, Jay, I don't know whether all nurses are using N95 masks throughout the system all the time or not. But the last thing you want to do is to trigger an infection coming from a healthcare provider. So that's one thing. Very quickly, the other piece of it is how do human resources develop caring environments about, touching on mental health and burnout, whether it's doing any good. Do the people on the front line feel like they're being cared for and getting the resources they need? So if there isn't a proper evaluation of that, then it's going to be ineffective. And my concern is a lot of money is going to go into this, and we're not methodically looking at our interventions making a difference to outcomes. And if you don't have a rigorous design to measure that, then you're just throwing your money away.
Yeah.
And that's my concern.
Well, I know that at the beginning of the pandemic, there was a lot of nurses who were like, stop buying us lunch. We don't stop. It's really nice that you keep on putting up signs like, oh, heroes work here or this or that. And like, give us the equipment we need. Make sure that we have backup staff. Make sure that, we are properly staffed. We have the proper equipment. The signs don't help us. Providing us like a banana and a granola bar in the great bake room, it's nice, but you're not addressing the key issues. And I think that some facilities have certainly done quite a bit in the way of providing more mental health support. But I think also it's in communicating that that's available, providing easy access to that mental health support, to the counseling, and then also to the time off. Providing time off. I know that OSHA finally just released and said, hey, you've got to give people time off to get vaccinated. And you also have to provide people time off if they are, in fact, infected. So, and that just happened, I think, 3 weeks ago. They finally put in an emergency standard rule. So I agree. We have to do more. And Jay, did you want to go ahead and answer that before we wrap up?
Sure, I can say that we are only using N95 masks for aerosol generating procedures, intubation, TEEs, things of that nature. That's the only time that we're using N95. When we follow the current CDC guidance on that, I will add one thing to what you said, Leah. Don't buy us food, just get vaccinated. If you'll just get vaccinated,
don't
please.
buy us food, just get vaccinated. Yeah.
Plenty of opportunities to do that.
Right. Just get vaccinated. What can we do to help? Just get vaccinated. That's wonderful. Well, thank you guys so much for all of your time today. You were absolutely wonderful guests, and I'm glad that we had this, very important conversation. I am very happy to have you guys on the round table, and I hope that we'll have you all back as guests sometime in the future.
Well, thank you
All
very
right,
much.
we appreciate it.
Thank you guys.
Thank
Thank you
you.
very much. And thank you, Jonathan and Joanne, for
All right,
hosting.
bye-bye.
And I really appreciate everybody tuning in today. We'll see you next week.
Okay. Bye now.
So if you guys just hang on for 1 second while Jonathan takes us down from online, then we can all leave. You guys did phenomenal. Thank you so much. You all have such like great points of view. And I know that